In this segment, we'll explore various tests to increase intrathecal pressure, commonly referred to as ITP. These tests are crucial for diagnosing conditions affecting the hip and surrounding areas. Let's delve into the Milgram test. The patient should be lying supine. Ask them to keep both legs straight and raise them to a position about 2 inches above the table. It's essential they hold this position for 30 seconds. A positive result occurs if the affected limb or limbs cannot be maintained in position for 30 seconds, or if symptoms are reproduced in the affected limb or limbs. This indicates intrathecal pathology such as a herniated disc. Now, let's look at the Naffziger test. The patient lies supine while the doctor gently compresses the jugular veins for 10 seconds until the patient's face flushes. Then, ask them to cough. A positive result is indicated by an increase in pain with coughing, suggesting an increase in intrathecal pressure, typically due to a space-occupying lesion. The Valsalva test involves the patient being seated, taking a deep breath, and then blowing out with a closed mouth, similar to straining at stool. A positive result, which includes pain in the back or down the legs, indicates a space-occupying lesion causing an increase in intrathecal pressure. However, a word of caution: the patient may become dizzy or lose consciousness due to restricted blood flow. Now let's explore the tests used to rock the SI joint. The pelvic rock test requires the patient to lie supine. The doctor then places his hands on the iliac crests with thumbs on the anterior superior iliac spine and palms on the iliac tubercles. The doctor then forcibly compresses the pelvis toward the midline of the body. If the patient experiences pain around the SI joint, it's a positive result indicating SI joint pathology. For Gaenslen's test, the patient lies supine and is asked to bring both legs onto his chest. Then, shift him to the side of the table so that one buttock is over the edge, while the other remains on the table. Allow his unsupported leg to drop over the edge while his opposite leg remains flexed. The doctor can apply overpressure to help stretch the leg. A positive result, which includes pain in the SI joint or hip, indicates SI joint pathology or hip pathology.